There's
So it's a
short
wide
list,
open,
just pick
yeah,
between those. Okay.
wide open request is harder than tell me you can make it one of these 5 days. Have fun.
May's a tough month. Finals, papers, kid getting married.
Hmm.
Few things happen.
Yeah, you're right.
I tried to be accommodating. I do the best I can do.
Well, let's call this meeting in order. Notice of an open work session to the City Council of the City of North Kansas City, Missouri, May 7th, 2019. Mr. Eric.
Thanks, sir. Tonight's work session is regarding proposed ordinances associated with medical marijuana. Chief Hargis, Chief Beamer, and Community Development Director Copeland have collaborated on the staff memo and the ordinance that's here in your packet for the work session. So I'll kick things off by asking Chief Beamer to begin.
Thank you, sir. As Mr. Berlin said, this was a group effort on our part to identify some issues that we thought were important regarding medical marijuana, and specifically medical marijuana and home cultivation. The commercial industry that is going to be coming to town potentially, it is an entirely separate operation, an entirely separate way that they're going to manage their piece of cultivation. But for the people that are going to do home grow, there's some things that we have some concerns about. And so before we go any further, Chief Hargis put together a PowerPoint to identify some of the things that we are concerned about in relation to home cultivation, and then we'll talk about some options and some of the research that we did.
Good evening, Mayor and Council. With medical marijuana becoming legal in Missouri, we found the need to make ordinances for public safety in the city. And marijuana has been legal in different states across the country. Ours is a little different, so we have some other experiences from other cities to go from. And Sarah and Steve are going to talk about the specific details of the ordinances. I'm going to give you an overview of the resident and public safety challenges that we foresee with home grow marijuana. As you can see from this slide, there's a lot of commercial stuff available for growing marijuana in your home. There's talking about grow lights, how to climate control, cloning and propagation. Most of the stuff that's available commercially, it talks about how to enhance your crop, how to grow the good stuff, but there's very little talk about safety involved with that. If everybody goes out and buys one of these, we're going to be okay. These things are set up, they're good to go. Typically, this is what we're going to see. If we're lucky, this is what we're going to see in our home grow operations. Unfortunately, we're going to see this as well. What you get into with this, with the lighting and ventilation systems, people overload their wiring, they use extension cords, they do all kinds of creative stuff, as you can see, but these are pictures of actual grow houses. This is the kind of things they do their own electrical work so that they can get everything plugged in. Sometimes it looks like this. This is probably an extreme case, but these are actual photographs from places that have had fires due to these. These are headlines from across the country, all associated with grow houses, whether it's the electrical issues, whether they're using gas trying to do home oil extraction. That's what we're seeing in the fire service. So that's what we're trying to do some stuff. Along with the fire, we have health issues. Not only does marijuana thrive in a warm, moist environment, so does mold. There's a lot of places around the country where that's becoming something you have to disclose when you sell a house, as if it has ever been used for a grow operation. So we don't want people burning their houses down. We don't want them living in moldy environments. So to address this, what we've come up with, one of the solutions we've talked about, is a registration process where anybody that has a medical marijuana home grow card from the state can come register with us. They have to show us that they have the card. They register through community development. There's no cost. we will offer an inspection of their cultivation area in their home if they request. We can't require them to do that, but if they want us to come in and look at their operation, to make sure they're meeting the safety codes and the building codes, we can do that. So that's what we're talking about. But like we talked about earlier, Missouri's amendment is different from a lot of other states. There's nuances. So this registration process could be challenged legally. But right now, this is the staff's recommendation that we do this because it's going to give the PD, our responders, an idea that if something's happening at that house, we know there's a grower operation in there, and there potentially could be some gases. It may be an electrical issue. So we'll have an idea it's there. Or if we respond on a medical call and we see this operation, we know that they've registered and they're legally doing that. So, and
Why can't, I mean, it looks to me like if they're registered, then we could probably, looks to me like we would have the right to go in and check to make sure whatever they're doing is up to snuff. Is that,
you want to answer that, Steve?
Don.
The issue as to registration, licensing, whatever term you choose to use, we have had, just so you know, members of the staff have participated in webinars regarding medical marijuana with the Missouri Municipal League. We have attended meetings with Lyndall Fraker, who is the director of medical marijuana for the state of Missouri now. We've asked questions about home grow and what we can and cannot regulate. By and large, the answer is we don't know. Now, as far as what's in Amendment 2 and what the Department of Health has created in terms of regulations, they are minimal. They've identified the maximum number of flowering and non-flowering plants that can be in a residence, and that number is 18 flowering and 18 non-flowering. And certain conditions have to exist for that to occur. There has to be so many qualifying patients. There has to be a number of qualified caregivers as well. So it's not going to be every home environment that could have that many plants, but that would be the maximum number that we would see. But because this is new law in the state of Missouri, the ordinances that we plagiarize, for lack of a better term, from other states, we're working with best practices and what's been identified as issues in other states. But to our knowledge, we can't find any other state that's really gone very far yet towards trying to regulate in any form medical marijuana at the home cultivation level.
Part of the other issue is that the way Amendment 2 is written, we're not able to put additional permit processes in place before someone can legally cultivate their marijuana if they have a state license. So we can't do local licensing for businesses, and we can't set up our own permit process for home cultivation. So we think this is a reasonable and still legal way forward for home cultivation to require registration rather than a permit process. And we did talk to an attorney who's been working on these issues, and his advice was a permit for home cultivation is probably not legal under Amendment 2, but a registration program probably is. So we're trying to strike that balance between what we can do under the terms of Amendment 2 and what we think is important for our own public safety here in North Kansas City. So the reason why, to answer your question, we've been advised that we probably can't because of the language in Amendment 2.
So what we're trying to do is do as much as we can to help keep the community safe without crossing any lines that could get us into a legal challenge or something like that. That's not to say a legal challenge may not occur at some point, but we think we are taking an approach here that is legally defensible if we are challenged. And to try and put things in perspective, based upon the estimates being provided by the state of Missouri as far as the number of qualifying patients that may be out there and the number of people that will home grow, we estimate 18 to 25 residences in this city will do home grow. And because of the large quantity of multifamily units that we have in this city, and some of the pictures that you saw in the PowerPoint, we think we have an obligation to try and keep the community safe by making sure that people that choose to home grow do so safely and not endangering the people around them.
Is it a possibility to work with the multifamily owners to require within their lease that they have to have an inspection to allow that within their building? So that, we could get in around the regulation of the state. That's the building owner saying, you can't grow here unless we permit you to do so.
I don't know if we're jumping ahead on your PowerPoint or not. One of the things that we plan to do after tonight is to send a letter to the landlords who have registered with us as part of our landlord registration, just letting them know about Amendment 2 and that home cultivation is permitted for people who have, the authorization from the state, and just to provide them with some information. We can't require them to include that in their leases, but we are concerned that they may not know that this has now been legalized, and so we want them just to be aware of that. Our reading of Amendment 2 is that private contracts can restrict where this is permissible, but we're not a party to those. So we're focusing more on trying to educate people about these issues and letting them know that they need to be looking into that as one way to try to address the public safety issues around all of our multifamily units and, single-family rental homes as well. But that would then be up to them to take any further steps about including language about this in their leases.
Yeah, I mean, that seems like the education portion of it, like I'm a landlord for another place. Like I had no idea that it was going to be home allowed. So this is good. And getting that word out is going to be important, but encouraging, not requiring, but encouraging. And I think you show those pictures you just put up, most are going to want to put that in the lease. Like you need to have an inspection. And since the vehicle will already be set up for that, just point them in that direction.
And that's what the registration will offer them, the inspection if they want to have that. And that'll, ensure the compliance with the building codes and their lighting systems and make sure they're not using gas products. But we'll also, if they don't want the inspection, we're going to put together a information packet saying, this is the maximum amount of lighting you should use. You should check your amperage, make sure your service is capable to handle the stuff you're putting in, so that at least we give them some education, tell them to make sure they don't grow mold. Give them that education, even if they don't want us in their place. It'll give us another avenue to get that information of those people that are doing it.
So since we're on this topic, because my questions were related to that, so do you know who has a state license so that you can target them with information?
That, once again, at this point in time, is a gray area.
Yeah.
Because the issue of HIPAA is coming into play here. We have been told, law enforcement's been told, that we will have access to that information if it is needed, but how that access shall be obtained and what is needed is not yet resolved to my knowledge. So, no, we may not know. If someone gets a home grow license, we're not going to be receiving any notification here at City Hall that that's happening.
Right.
So that's one of the reasons that we're hoping to get registration compliance from our residents for a couple of reasons. Number one, it helps the fire department if there's an issue there. Number two, your neighbor calls and says, yeah, I got this guy's got a bunch of marijuana plants in his house. They may be legal. He may have the appropriate paperwork. They may not be legal. And so if we can help establish legal versus illegal operations, then it helps us in doing our job as well.
Mm-hmm. Yeah, I think it's my concern or my question is, and maybe this isn't easily answered, is how do you encourage people? You can encourage people to register, but it's voluntary, I guess, to some extent. They don't have to register. You wouldn't know. I mean, you view it as non-voluntary, but they're going to view it as voluntary. So how do you overcome there are people who don't trust, right? They think you're going to put them on a list, you're going to harass them, you're going to come after them,
Sure.
They're going to have that perception because they don't know, what good, awesome guys you are. And so they won't necessarily register. So I guess I'm trying to figure out, how do you cross that hurdle, and how do you get there?
If we discover there's an operation, a grow operation, that the person has the appropriate state paperwork, we are going to have an ordinance that says you're required to register. They could be cited into municipal court for failing to register their operation. Or the other provisions of this code or the other ordinances that we're looking to bring to you about not being able to use ozone generators in the house, not being able to use butane in the house. If they are generating an undue odor level that they're starting to impact their neighbors, or if the lighting is so bright that their neighbors are getting suntans in their apartment next door, or something like that. Those are the types of things that we're trying to work on here, just to make sure that those people that are home growing do not impact the people living around them or endanger the people living around them.
I mean, because we aren't able to get a lot of clear information from the state, this is a very much probably a reactionary ordinance, in that it's going to be hard for us to ensure voluntary compliance up front. So part of what we're trying to do here is, what are the worst case scenarios where we'd want to be able to bring somebody into municipal court, and to include those in the ordinance, because they're going to be people who will register because, they don't have any concerns and they know that there are rules that they should follow. It's the people who aren't going to register that will probably have issues with, and it's just like any other code enforcement situation. This is trying to give us a way to react to problems and to the problems that we know about. I mean, it's not going to be perfect.
Are there ways to detect outside of like barging into a home? Are there like sensors that can be run around like on a vehicle or on something that would detect if there was an odor or a chemical in the air that comes off?
It depends on how big the grow operation is. I mean, in true grow houses, law enforcement has been known to fly helicopters over neighborhoods and with a thermal imaging camera to find the hot houses. You can usually get information from like the power and light company if you've got excessive usage at a house compared to everything else in the neighborhood. That's not our intent. I mean, it's legal to grow if you have the proper state paperwork, and we don't want to stop anybody from doing what Amendment 2 is allowing them to do. So we're not going out here to try to put our thumb on everybody who is exercising their rights under Amendment 2. That's not what this is about. This is about trying to make it safe for them and everyone else. And that's what we've tried to balance here in this core group of ordinances that we're discussing right now.
Because these ordinances are basically on the home cultivation, because the commercial side, they have to meet the commercial licensing, the commercial codes, the building codes, all of that is already in place. There's a few nuances, but most of that's already in place. They have to get the occupancy permits and everything like that. It's this stuff here that we want to protect the people's neighbors. We don't want your neighbor burning your house down because they were doing home extraction of oils. We want to make sure they comply with the other codes. And we want to provide clarity to them. This is what the ordinances in North Kansas City are. And when something does happen, to kind of be proactive with getting those ordinances out there ahead of time, so we're not doing reactionary ordinances, because it always looks bad when you have an issue and then you pass an ordinance the next week to counter that. So we've been looking around and researching what's been happening in the states across the country. And, if nothing else, we want to give them, the home growers, some information to keep their operations safe.
Yeah, I think that the intent is right. I mean, I think people just, how they perceive it is going to be one way or the other. So I agree with Councilmember Smith that I think education is very important, and not just to landlords, but to residents and to homeowners, and just spread the word so they understand the intent behind the ordinances.
In terms of timeline, people can begin applying for their personal marijuana cards, their marijuana patient card And then qualifying caregivers can apply also for the home cultivation licenses. All of that starts July 4th of this year. On August 4th is when those licenses and permits for home cultivation will be issued. And so one of the reasons that we're in front of you tonight is if the council agrees that you want to move forward with this package of ordinances, then they'll be in place well before anybody can actually start legally growing their own marijuana. And if they're starting to make plans, we will have this information available for them as they start doing their preparations for home grow.
Hold on.
Oh.
Yeah, I definitely agree with Councilmember Smith and Pierman that education is a key, and, getting information out on our website, and maybe even, I don't know if we put it in the connection or not. I feel that these should be regulated as well, along with, the businesses, the home grow for public safety. I will tell you, I voted for Amendment 2, but I think that we should have some controls in place for public safety as well. So, some of these ordinances I think are a good idea. The only question I have, you had mentioned HIPAA in regards to like patient confidentiality. Is there any conflict with the registration process? When you spoke to the attorney at all, was there any concerns in that area or not? Either one of you, Sarah?
It did not come up in the conversations with the attorney that has represented the MML. And I still think the HIPAA thing is unresolved, that the Department of Health is still trying to establish
Okay.
the
Guidelines.
issues there and the guidelines exactly. And no, I don't think HIPAA is going to impact us because if a person wants to home grow and they've already obtained the permit, then they're just going to come in and get it. And we're not publishing this information any place, and we are not bound by any HIPAA requirements as a city. We are not a healthcare provider.
And we don't know what to call, we're not gonna ask them why you're growing it, or
Yeah,
for whatever,
that's
for
what
what
I-
your,
Card,
what your
yeah.
medical condition is not gonna be part of that process. It would be the same as, people going into CVS. They're going in there to get a prescription, but you don't know what they're getting and what it's for.
Yeah.
It's that medical, knowledge of their illness attached with their name. And some of the people getting the grow permits may be caregivers of someone else, so
I think as long as you don't ask why, I think
Right.
then you're safe, because HIPAA does apply to more than just healthcare providers, but I think you have to have a little bit more information as to a why, not just a who and a what they're doing, because they could be growing it for somebody else.
So when they get their grow permit from the state, how long does that last? Do they have to renew it yearly?
1 year.
Okay, so ours matches up with that. Okay.
And
Thank you.
I have a question. When they get their grow permit, is there any reason why we can't also provide that? Can they provide that information to the people getting the grow permit at that time? I mean, information about safety and the things that we're going to require with registration?
We don't know
Couldn't they
what,
get that same information?
when the Department of Health and part of one of the seminars that I attended, they're talking about not even issuing paper cards. They're talking about issuing electronic cards so that if you're a qualifying patient, you carry it around on your phone. Or it's delivered to you electronically and you can print it out at home. But one of the mailing process in Arizona has proved to be very cumbersome. And so Missouri's trying to learn from that, and they're talking about just issuing electronic qualifying patient cards. As far as the home cultivation permits, there is a requirement that the state permit is displayed with the plants that are associated with that permit. So if we walked into a room and there's plants in there, especially if there was 18 plants in there, there should be 3 separate permits associated with that.
Okay, we're talking about the grow. Okay, well, growing is just the start. Okay, I don't know much about it, but I guess you gotta dry it out first before you can smoke it. Is this all allowed, or like getting the juice out of it, or whatever they do? Is this allowed in the home grow? I mean, there's,
Growing it, okay. In terms of growing it and drying it, yes, that would be something that is absolutely part of home cultivation. Extraction is is removing the THC oils from the plant. To extract involves the use of volatile substances, the most popular of which is butane. We do not, first of all, to do extraction, you have to be licensed by the Department of Health, and those extraction licenses are only going to be issued to commercial operations. They are not going to be issued at home cultivation. Extraction with butane, if not done properly, is dangerous. And a couple of those pictures up there of homes on fire were because somebody decided they were going to extract butane or extract with butane, and then the gases got to the motor on mom's refrigerator, and the next thing you know, the wall's missing out of the house.
Because if you don't, butane and propane are almost the same thing. They're in the same chemical family, so.
okay, in other words, what a home grow is basically growing it, drying it, and smoking it,
Yes.
Or eating
or
it,
chewing it, or, I don't know what you do.
ingesting it.
Yeah, I guess you could put it in brownies or something like that if you wanted to, but as far as extracting the oils, that is specifically going to be prohibited in our ordinances, and the state is not going to license home extraction.
So we did draft an ordinance that was attached to the memo for tonight that, laid out all of the ordinance language that we would propose for this. So this creates a new chapter 8.60 on marijuana cultivation, sets up the registration program, establishes rules for home cultivation by qualifying patients, including things like you can't use compressed gas products or butane or solvents in your home cultivation. It includes a short section on general cultivation and use, basically just saying you can't consume marijuana in public, and you can't extract any resins from marijuana without a infused products manufacturing facility license. It also includes a public nuisance section that the smell or odor from marijuana will be treated like a public nuisance. And then it also includes some amendments to some of our existing ordinances. So section 9.24.030 is a list of drugs that it's illegal to possess in North Kansas City. We need to take marijuana off that list because now it's legal to possess it under certain conditions. So we've amended that section and then created, we have a section right now on growing marijuana because it's currently illegal to grow marijuana in the city of North Kansas City. So we need to amend that section also. So this ordinance would change that section into a new section on possession of marijuana and establishes some who can possess marijuana legally within the city. That's a qualifying patient or a primary caregiver or an owner or employee of a medical marijuana facility that has a medical marijuana facility employee card. And it establishes that, people who are in possession of medical marijuana need to have that card on them to show to law enforcement. And that if you're transporting medical marijuana in the city, it needs to be in its original packaging or properly labeled if you've grown it at home. So this draft ordinance, the only thing it's missing at this point is some definitions. We need to decide if we need to define any terms here. If you're comfortable with this, we would intend to put it on a very soon agenda for consideration to amend our municipal code. And at that point, we think that we've covered all of our bases for establishing a framework for medical marijuana in the city. But if you had any questions or concerns about the ordinance language, we would be happy to address those.
I have a question. As far as you said, as far as the consumption and not in a public place, as far as like where smoking's allowed or what have you, like around different parts of the city, then it basically, are we trying to make sure that it is consumed at their residence, correct?
Well,
and
the-
not out in public.
Right, specifically how that's worded is no person shall consume marijuana for medical use in a public place unless provided by law. So I think there's still a question mark about whether you could consume medical marijuana in a hospital or clinic setting. But yes, generally, we want people to consume this at home and
Correct.
not anywhere else.
And then transported from the distributor to the home has to be in the original packaging.
Yes.
And you have to have your card with you. Okay.
Yes, because there are still situations in which it is illegal for you to have marijuana and to be consuming it. So we're trying
Absolutely.
to be clear about
Define
what
it.
is legal, because anything else is still illegal.
Correct. Okay, very good.
Kind of on the same line, along the same lines as his question. So if someone is out medicating in their front yard, that is legal. But if the odor goes into their neighbor's yard and it bothers them, then that, under the next section, becomes a public nuisance.
Potentially, yes. I mean, and, you know, we're breaking new ground here in Missouri, and so there are pieces of this that we're gonna still be working our way through. One thing to remember with medical marijuana is, and I can't remember the statistic, and I'm looking at Mr. Mitchell and Mr. Brown back there, but I think 70% of medical marijuana is consumed now in edible form or in oil form. It's not that much of it that is actually smoked. Now, home grow, different situation. But much of the medical marijuana consumption is not through smoking anymore. So if you are on your front porch and the odor is reaching the house next door and that's offensive to your neighbor and they contact us, then we are going to get involved in that, yes.
Okay.
Because at that point in time, you may have crossed the threshold and are creating a nuisance to your neighbors.
Thank you.
Seeing how all of this stuff is still not settled, we can always add or subtract to this ordinance as we see fit.
Yes.
I
And
have a
I would, as we discussed with the zoning ordinance amendments, we will continue to learn more about this through the next several months as people start getting their licenses and we learn more about how it works in practice. But we've done our best to try to learn from, states around us about best practices and what we can and can't do.
Sarah, this, and I'm not trying to be picky, but I'm just curious, when it says in a sealed container, I mean, obviously that would be the homegrown in the sealed container with the patient's name. That could be just about anything, couldn't it? I mean, is there, as long as it's
Yeah,
sealed
sealed.
in some manner, and that you put your own name on it? Okay, just being clear, that,
I
And
wanna
with
know
as
what-
early as we're getting some of this stuff put together, we could actually be setting the precedent for other municipalities to use
Yeah.
this stuff that we're putting together here
Oh, I
too,
agree.
so.
That's what I was gonna ask you, is do we know who's doing what around here as far as other municipalities and?
I've talked to other chiefs, and I go, what are you guys doing on this? And it has been anything from, well, we haven't thought about it yet, to, well, we can't do anything. Amendment 2 won't let us do anything, which is not true, to, I don't know, what are you guys going to do? So I really do think, I mean, quite frankly, I think that we are somewhat on the leading edge of this in terms of trying to get this in place before the state starts issuing cards.
Good, that's very good.
Tom?
I think you guys have done a wonderful job. We have to start somewhere. And I'm glad to hear that we're on the cutting edge of this, because that's what I wanted a long time ago. I thought, it's coming, there's nothing we can do about it. Let's go out front, let's see what we can do, let's get the business in here. Let's show everybody that we are concerned for our citizens, the welfare of our community, and we're gonna do something about it, which the three of you have done. I commend you on this. We have to start somewhere, so I'm all for it. I mean, we don't know if this is right or wrong, but neither does anybody else. And like Steve said, at least we're doing something about it. We're not holding a blind eye. It's like, oh, well, we'll see what happens next.
Yeah, I agree.
I agree.
I think we're doing it right.
Yeah,
Wrong.
let's go forward.
Let's do it.
And there can't be any argument for those for or against it. I mean, it is coming, but you've done it in a respectful manner that is respectful to the Amendment 2, without prohibiting people from what they're legally entitled to, but still answering the concerns of people who are not in favor of what happened with Amendment 2. I think this is a great idea, because it's respectful on both sides. I don't see how you could argue on either side that you're restricting in an inappropriate manner.
Well, and thank you. I mean, I think the three of us did well. It was fun working on this. We really, I mean, it was fun working through it, but I think what we are presenting to you tonight is a balanced approach to do what we need to do to protect everyone.
You have to have web filters turned off on your browsers before we started this.
Move to adjourn.
Second.
All in favor?
Aye.
Opposed? I guess we're done.